Joining us on the program once again from CBM, Darren Ward. Good morning, sir.
Good morning, Andrew. How are you this morning?
Yeah, doing very well. Actually, had a day off yesterday to access some health care. It was one of those things where I needed a specialist appointment, nothing too serious, but the specialists only were available for appointments in the morning. And given that I do a morning show on the radio, that that didn't really work for me. So it seems like a Monday to me, even though it's a Wednesday. So it's not too bad.
Not too bad. Yeah, I'd hate to cast aspersions, but, they may well have been playing golf yesterday afternoon.
It was a very good day for golf, as far as I'm aware. I mean, looking at the access of healthcare, because, here's me moaning about having to have a morning appointment, but in places of the world, places around the world where you guys work, access to healthcare certainly isn't a given.
Look, that's absolutely right. In some of the places we work, there just is not simply the basic healthcare available for any of the population, but things are improving. We're seeing some of the basic healthcare provisions provided in even some of the more remote places now, but unfortunately for people with disabilities, accessing healthcare remains a massive issue. And look, that's born out of things that are both skill or competency based, and that the skills and understanding of what is needed to provide services and rehabilitation for people with disabilities doesn't exist. And in other places, it's even more basic and troubling than that. It's just that they don't see the point in providing services for people with disabilities.
Which, is a shocking thing, but, some people might say, well, look, if you've only got a very small amount of healthcare available, then let's spread that as thinly as we can across as many people as possible. If we had a full health service, we could extend that to everybody, but there's only so many cookies in the jar, as it were.
Look, and, there is, at one level, some logic to that argument. However, we know from the work we've done, we know from research that by providing healthcare, particularly rehabilitative healthcare, which is not terribly expensive to provide, you can actually increase the participation of people within communities. For example, we know, someone who may be living with the effects of polio, if they can get rehabilitative care, if they can get things like calipers to help them walk, if they can get access to wheelchairs, etc., they can then start participating in the community. They can then start actually contributing to the well-being of a community, and rather than being someone that is seen as needing help, they're seen as someone who can actually contribute to the ability to provide help. And so it's really whether you take the short-term view or the slightly longer-term view of what is the best for a community. So that's an economic or a logical argument, against the theory put forward. I think the other one that we've got to look at and is the human rights basis to it, and the fact that actually everybody has a right to access basic health care and to receive the things they need to be able to live a full life, and that really is where we work hard and butt heads with people occasionally around that area of who actually is entitled to receive health care, who is entitled to get the basics in life. We see the same things in education and what have you, but particularly in healthcare, where it's about providing often quite basic treatments to enable people to then participate. It's around changing the mindsets and that, and that's really a human rights issue in terms of and to assess that, we need to look at, well, how would we like our lives to play out? How would we like to live our lives? For you yesterday, the ability to go and see the specialist, if they had have said, look, we're sorry, Andrew, we've only got so much money to go around, and your issue is just one we're taking off the table, so there's no more help. Tough luck. I don't think we would accept that, and I think we need to look at that and take that same sort of approach in terms of the expectations we have of people in poorer countries to be able to access those things that we take for granted.
Oh, it is, I suppose, one thing to say, well, here's bureaucrats, small-minded bureaucrats with budgets and not seeing the bigger picture. That can happen in any part of the world. But that attitude to say that actually this person, because of their disability, because of what caste they may be from, or because of the circumstances into which they're born, they're less of a priority because of the sort of person that they are, that's unacceptable.
Absolutely unacceptable. And it comes down to their value of life. And I think, one of the things that we've talked about often is the fact that as Christians, we believe that everybody has got value to offer, has got something to offer, has a God-given purpose. And again, we've talked a lot about how if we look through that lens at people, our view of things like disability, social inequality, etc., race, gender, all of those sort of things change because we see a person in front of us who is, special to God and has something to offer. And, if we can encourage that view, and that starts with us living that out, and we can encourage others to take that view, we will see things shift. We will see funding made available for areas that currently are underfunded. And it may be that it's not actually government funding initially that does that in these countries, that it's actually provided through organisations like CBM, where we go in and we actually provide some of this base level care to start with. We work with local partners to build up their capacity, but then over time we're able to transition that into working with government through their national health program, their national healthcare policy and network to ensure that provision is there by setting an example. And that example starts in New Zealand with people saying, hey, that's not right, everybody should have access, we want to support that, to putting that in place in the field, to then doing the advocacy work with local government and eventually transitioning it.
Yeah, I mean, it's fun work that you do, not just helping individuals on the ground, but also changing government attitudes across the world. But we thank you very much for the work that you do. Darren Ward, thanks for joining us.
Thanks, Andrew.